Good morning, everyone. My name is Kim Adams. I'm going to be the patient's nurse today, and we're going to demonstrate how to administer an IV maintenance line, an IV piggyback, and an IV injection, also called an IV push. We're going to show you the skills that you need to complete your IV medication competency med checkoff. First things first, hand hygiene. We're going to go ahead and scrub our hands. This is a clean technique, but we want you to be as sterile as possible. No, you do not have to wear sterile gloves, but yes, you do have to keep your equipment sterile and your technique sterile. Okay, so our next step is we're going to prepare our IV tubing. We're going to begin by opening up our IV fluids. In your MAR, you're going to find this big IV bag under your continuous fluids tab. These are the medications, the fluids that will run over 24-hour period. So as soon as this bag goes dry, we're going to just spike and hang a new one. Hence, they're called continuous fluids. You'll also hear them being called maintenance fluids. So we have our IV fluid bag. We have our tubing. So if you want to zoom in on this tubing, it is our primary set. So this is our primary tubing to run with fluids that will run over 24 hours. This also is the tubing that we need to initiate the pump. So you can't run anything unless you have this tubing. Your first stop on the tubing is you're going to make sure you have your dial in the closed position. So to close it, you kind of turn it and push it in. The next thing we're going to do is what's called spike the bag. We're going to take off this cap and we're going to take off the red cap on our fluid bag. Now, this is very sharp. You do not want to touch it for two reasons. One, it could pierce your skin. And two, we don't want you to contaminate your equipment. So we're going to take off our caps here. The next thing we're going to do is we are going to push and turn. Now you see the injection port. This needs to be held straight. And we're going to push and we're going to turn and we are going to pierce our bag. Now, fair warning, in the hospital, it is much easier to spike. These are practice bags and sometimes they do leak, as you can see, when you are spiking your bag. We're going to go ahead and hang this bag up on our IV pole. Our next step is we're going to assess our IV site. So when you're looking at your IV site, you're looking at the area where the catheter touches the skin. You're looking for any redness, swelling, drainage, if there's anything leaking at the site, if the patient experiencing pain. You're also feeling the extremity to make sure that it's not too cool or too hot to the touch. Now, caveat to this dressing. Right now, we're in the lab. You cannot see the IV site. In the hospital, this will be a clear, transparent dressing. So you're making sure that dressing is intact and you're looking in that clear window at the area where the IV catheter touches the skin. Next thing you're going to do is you're going to remove these Curos caps. These Curos caps are different colors in the hospital. They have a antimicrobial feature where they help to prevent central line infections. So you want to get a new and fresh cap after each time you take it off. So we're going to go ahead and we're going to scrub our IV pump. We're going to let that air dry. And while that's drying, we're going to go ahead and get our syringe ready. This is our IV flush. They are pre-filled with normal saline. The first thing you have to do is you need to get the air out of that syringe. We do that by gently pulling back first. This releases the pressure that is built up in our syringe. You'll kind of hear it click. And then we're going to go ahead and we're going to expel that air. If you do not pull back first, half of this syringe will end up being on the ceiling. There's way too much pressure in these syringes. We're going to go ahead and push and turn. A normal IV flush is 2 to 6 milliliters. And when we're flushing, we're pushing saline into our tubing and into the vessel. This ensures that our line is patent. We use what's called a push-pause method, where we push a little, we pause, we push a little, we pause. The clamp needs to be in the open position and it just slides back and forth. So we're gonna go ahead and push the 2+ cc's of sterile saline, and we can see that site is clean, dry, and intact. There is no leaking. The patient is not complaining of pain, and the extremity is nice and warm to touch. We're going to close our clamp. We're going to go ahead and replace a fresh Curo cap. And prior to putting that Curo cap on, we're going to go ahead and we're going to clean our injection site just one more time. Maybe I can get it out. There we go. Okay, our next step is we are going to prime our tubing. Priming means we're getting rid of all the air in the tubing and filling it with fluid. First step after spiking our bag is squeezing our drip chamber until it's halfway full. Now you can see this clear plastic cap is over top of the vent. You want to make sure this is pushed in when you have plastic bags. If you're using a medication that comes in a glass container, you would open that vent up to allow air to escape. But for your comp purposes, we are keeping this little tab pushed in. Next thing we're going to do is we're going to invert and turn our cassette upside down. So the blue port is pointing towards your shoe. You're going to open this dial by turning it, and we should see fluid beginning to flow. Okay, and you see fluid is flowing. As soon as we have the injection port filling with fluid, we're gonna flip it upside down, and you can see the fluid is just about to the end of this. Okay, our IV tubing is filled with fluid to the very, very end. Our next step is inserting the cassette into our IV pump. We're going to go ahead and pull up on our purple lever. We are holding on to the little tab that is in the front of your cassette, and this cassette will slide very, very superficially, almost next to this door. If you look inside, you're going to see a black dark circle. Your white fluid stopper will fit directly in that stopper. So you want to kind of get it all lined up here. So it's going to slide right in. You never want to force it in. You're also going to go ahead and press your tubing into this A side and close your door. We're going to turn our machine on with the blue on-off button. You'll have to hold it in for about 30 seconds. The next step is we're going to use our up and down arrows to select step down. All of our students, or most of our students, are going to be on a step down unit. So I'm going to demonstrate using step down. If you were on a med-surg unit, of course you would use that med-surg. And what this ties us to is the drug library that is common for the patients on those specific units. After you have step down highlighted, you're going to hit the button below that says choose. At this point, we are setting up a maintenance continuous IV fluid. So we're going to choose and select the A side. You can see below all of the numbers are letters. We're going to set up an IV fluid. So we're going to hit the 4 button 3 times. Now look closely. You'll see the first time you hit 4, you're going to see a G. The second time you hit 4 is the H. Third time would be the I. So each of those presses of that button will correlate to a letter. So 1, 2, 3, we have I. And we're going to scroll down to the IV fluid. And we're going to choose that. The first thing it's asking me is, what is my volume of the container? So this container has a total of 1,000 milliliters. So I'm going to enter in 1,000. I'm going to use my arrow to scroll down. The rate will be determined by your physicians. This will be ordered, and we're going to say we are starting at a rate of 100 milliliters per hour. The VTBI is your volume to be infused. So in this situation, we know we have 1,000 milliliters in this bag. This is a continuous fluid. So the minute the bag goes dry, we're going to go ahead and we are going to hang another bag. So we're going to give ourselves some time. So instead of entering the volume to be infused as the whole 1,000, we're actually going to enter in 900. So that will give the nurse a little bit of time to get back there to get a new bag before there becomes air in the line. The next thing we're going to do is we're going to scroll down here, and it automatically converted and said that I will have 9 hours of this IV bag infusing before I have to get a new one. After we double check and verify our order is correct and our rate and volume are both correct, we're going to go ahead and we're going to hit start to confirm. So the green start button will give us the confirmation screen, and it's saying, do you want to continue with this infusion and start the delivery? Yes, I do. And you can see by the drips flowing into the drip chamber that our IV medication, our IV maintenance bag is now infusing. All right, our next step will be to insert our IV tubing after we have it already primed and programmed. And we insert our tubing by pushing and turning. We're going to open up our clamp, and we're going to go ahead and hit our start button. Okay, our next task is that our patient requires an IV injection or an IV push. We're going to use the port that is closest to our patient. We're going to go ahead and scrub that hub. We're going to insert our syringe. When you go to use your push-pause method, one thing you need to remember is that you will have to find out how much time you should be giving this medication over. Usually it's over 30 seconds to a few minutes. That will be found in your drug book or on UpToDate. When you go to push your medication, you're going to pinch the tubing off distal to your patient as you're giving a little push. So we're going to do a push pause by pushing the medication while clamping or pinching off the tubing. Okay, once your IV tubing is primed, we have it attached to your cassette. We're going to go ahead and we're going to program your B side or your IV piggyback. So we're going to click the B button. We are going to just use IV fluid for today's demonstration, and you will program this based on the medication that you are ordered to administer. On this screen, you're going to put the container volume. You're going to place the rate. The volume to be infused would be the entire medication. So you would put everything that's in this container, you would enter in as your volume to be infused, and that will calculate over how long you will be administering your medication. We are going to get our secondary or piggyback medication ready. First thing we'll do is go ahead and choose the secondary tubing. We're going to make sure that our clamps are closed by just rolling that dial. And we're going to go through the same process of priming our line to ensure all the air is out before we connect our tubing. So we're going to go ahead and take off our red cap. We're going to take off the cap on our spike. And we're going to go ahead and spike our bag. Again, we want to make sure we keep this injection port sterile. And we also want to make sure we keep it straight up and down. And we're going to go ahead and push and turn. And we're going to hang this on our machine, on the IV pole. We'll squeeze our drip chamber till we are halfway full. And we are going to slowly unroll our dial. And we're going to fill the entire length of the tubing with our IV fluid to ensure all the air is being pushed out. we're going to close our clamp. We're going to scrub the blue injection port that is on the top of our cassette. We're going to remove our cap and insert our tubing. And this is one where you're going to twist as you push in. The tubing will then be connected into the B side of our pump. At this point, we can go ahead and open up our dial clamp.
Steps. Exceptional care, better health.